It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision-making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question from one of our readers. And the question last week was, my brother has COPD and went into cardiac arrest. Does he need to have an immediate lung transplant because of minimal lung function? You can check out last week's questions by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer questions from one of my clients, Jim, as part of my one-on-one consulting and advocacy service. Jim's brother is in the ICU after a cardiac bypass. Unfortunately, he had a cardiac arrest and he's now asking why it takes so long for his brother's recovery. So this week's email consulting session is, my brother had bypass surgery and a cardiac arrest in ICU. Can he recover? So I'm going to read out the email consulting session between Jim and myself. So Jim writes, Hi Patrick. My brother is 82 years old, had triple bypass cardiac surgery along with his carotid artery cleaned and cardiac ablation. All procedures were done at once. The surgery was performed on the 12th of July. The next day they had to go back in because there was abnormal and excessive bleeding. There were no problems found with anything from the surgery. For example, there were no missed sutures, etc. But they did suction off the excess blood. His bleeding did slow down in a couple of days, and they thought it may have been caused because the blood was not clotting normally because of his liver not functioning fully due to his slight liver cirrhosis caused by hepatitis C, which he's in the middle of treatment for as well. He opened his eyes the next day on July the 13th and slowly became aware of his daughter, though of course was still sedated and groggy. He got extubated the next day on July the 14th and he showed good signs of a sharp mind and he could slightly talk. He still of course had mobility issues but could move his arms and slightly move his toes. He was extremely weak and he was having problems coughing up sputum. They had to intubate him again on July the 18th, and it was suspected that pneumonia was the possible cause. They immediately started treating him with a broad-spectrum antibiotic. Days later, the cultures came back positive. He was then extubated again on July the 21st. He was still exhibiting signs of weakness and could still only move his arms, wiggle his toes, and slightly resist pushing against his feet. His swelling was coming down, but on the 24th or 25th of July, they ended up tapping his lungs to drain fluids, about 800 mils. At this point, he was still having problems spitting out his sputum by himself. On July 26th, around 11 p.m., he crashed and was down for about 4 to 5 minutes. Chest compressions were started within 1 minute. He was intubated once again. On July the 28th, they inserted a pacemaker and the outcome was initially very good. His heart rhythm and blood pressure completely stabilized. He's now down to almost no medications and they're now talking about a tracheostomy and PEG and then off to LTAC. Today he showed very good results from his trial extubation. Extubation means removal of the breathing tube or endotracheal tube. He has been on the trial since 9:15 a.m. and the ventilator has hardly had to help him. They of course will turn it back to full strength tonight so he can sleep and will resume trials again in the morning. No matter what though, they still want to do a tracheostomy. I would imagine this would be a precautionary step. They don't want to have to re-intubate him again, but want to have the tracheostomy available in the event his breathing becomes troubled. I'm guessing on this one. The PEG, I'm not really sure about, but my guess is because the difficulties caused from the breathing tube or endotracheal tube may delay him eating by mouth, and also because the pneumonia was probably caused by aspiration, and the possibility of it happening again with food and water by mouth is high. His wife, my sister, has been and will be very active in his care in the ICU, and as well as LTAC if he goes there, when he comes home. I'm also active as much as I can be and play a more supportive role in keeping her spirits up and not letting her fall into negative thoughts, thus keeping her energy positive for her husband, who can be a very negative person. Thankfully, in this case, he is very selfish and loves himself enough to fight hard to get better. My other role is to research the things the medical people are saying, suggesting and doing to make sure the right things are being done. My sister has too much stress already and doesn't have the time and energy to do this part as well. So I am her research department. Your website has a lot of great information and resources. Thank you for having it out there. Yours respectfully, from Jim. Here is my response. Hi Jim, thank you for sharing your brother's situation and thank you for your kind words. From what you are sharing, I have the following concerns and insights. Tracheostomy can be done if all other avenues for extubation have failed. So what do I mean by that? The worst case scenario for any ICU is to have their beds occupied with long-term patients. ICU beds are in high demand, hence they know they can fill their beds with the next patient waiting, and usually the longer a patient stays in ICU, the less money they are making. Therefore, a tracheostomy and getting your brother off to LTAC may well be self-serving for the ICU. From my experience, as soon as a tracheostomy is done, patients can get transferred within less than 48 hours if they are medically stable. Especially with everything he has been through, I question that he's ready for LTAC because I don't think he's medically stable yet. Furthermore, especially with all the weaning trials you are describing, I believe he's close to coming off the ventilator and the breathing tube. You are correct to point out that your brother might have had the pneumonia from aspiration. However, he was on and off the ventilator for a long time, and ventilator-associated pneumonia could have also been a cause. Also, a tracheostomy is often not a precautionary step, but rather a vehicle to get patients out of ICU quickly, especially in the United States. Also, here is an article or video that you can look at, how to wean a critically ill patient in intensive care off the ventilator and the breathing tube. Go and have a look there. I put a link below this video in the written version of this blog to that video. Here are also other articles and videos that will help you in your research if a tracheostomy will be the right thing to do or not. For example, one article and video is how long should a patient be on a ventilator before having a tracheostomy? The next one is how long can a breathing tube or an endotracheal tube stay in? And the next one is what are the risks and benefits of a tracheostomy? Again, I put links to those articles and videos below this video, so if you are scrolling down, you can look it up there. Also, Jim, I would be very happy to speak to you and give you some more tips and strategies to get your brother off the ventilator. So either book a free call here or give me a call on one of the numbers on the top of our website and we can discuss. I would also be very happy to talk to the doctors and nurses and find out what's really happening and find out if they are doing all the right things in order to get your brother off the ventilator. So, here is Jim's response. Jim says, "Hi Patrick, I would like to have you talk with my sister. Her husband has been on the tracheostomy now since July the 26th and he's still in the cardiac ICU. They did not ship him off straight away to LTAC. He's now ready to go to LTAC and will probably be transferred this coming Wednesday. We have visited the facility and are, for the most part, pleased with what we saw, observed, and our numerous questions that were answered. As she was extremely involved with his care in ICU, she will continue to be extremely involved at the LTAC facility. Lately, she has been a little bit doubtful about her husband making a full recovery. By full, I mean coming home, walking and living life the way he did before the surgery. His regular cardiac doctor and the cardiac surgeon who performed the surgery both have told her that he will make a full recovery. They are very confident that he will, and his regular cardiac doctor even gave him a 90% chance of full recovery. I wasn't there when they told her this, and I would have asked them to define what they mean by a full recovery. Their definition and ours could have been different. But I still think that their confidence says a lot to him getting to our definition. The problem with her right now is the doom and gloom mentality of the ICU staff that is throwing off her confidence. They never seem to be overly optimistic, and this is playing into her doubtfulness. This is where you come in. I know that you won't sugarcoat anything and will be blunt, honest, and positive. That's all she wants. She wants to mentally prepare for what reality will probably be at and after LTAC, and what outcome is most likely for her husband and our family. We know that ICU, LTAC, and if need be, skilled nursing facilities all have their agendas. Some of them are hidden and some of them are open. We need to know what they are and will be doing the right steps and not prolonging their care for him to further their financial agendas. We and my sister need to know when to push the facilities because they are unnecessarily stalling, and when not to because it really does need time and professional insights. I'm not sure we need the 5-session package you have listed on your website because we have already made it through the ICU phase. But I was wondering if you would do a 1-hour call with my sister-in-law where she could fill you in on her husband's history in ICU, where he's now and where he will be going. She's a strong, feisty woman who will demand and get people to do what she wants and at the same time make those people love her for the most part. She's a force to be reckoned with. But from time to time, she has moments of uncertainty, doubts, and negativity. Once again, in this situation, I think you would be a valuable asset to help her get through the uncertainty, doubts, and the negativity and give her a clear picture of what to do and most of all, what to expect. If you would please respond and let me know what we can do for a 1-hour phone or Skype session with maybe a month of email support as well. Thank you again for your wonderful website and support from Jim. Here is my response. Thank you, Jim. Just to quickly summarize, I do believe your brother is in a much better position than initially thought he'd be, given he's been off the ventilator for about 7 days. That's a good start, and it's good to know that he's been getting out of bed regularly. I do believe this to be an insurance issue, and if you can keep asking for the admission criteria for LTAC versus skilled nursing home, you should get all the answers you need. Also, as I mentioned before, please have a listen to a podcast and an interview here. I interviewed a gentleman a year ago, an interview with Charlie Atkinson, who was a patient in ICU and LTAC for more than 12 months and survived against the odds. You should listen to Charlie's inspirational story, and I'll put a link again below this video to this interview. If you need more help, I'd be very happy to counsel, consult, and help you advocating for your brother and for your husband. So here is Jim's response. Hi, Patrick. It was very interesting and helpful when we spoke on the phone today, which gave me ammunition for my next meeting with the case manager, which is tomorrow, by the way, and we need a lot of luck. So a little summary of my husband's situation for tonight. His blood pressure is 98/48. His heart rate is 87 whilst he's taking digoxin. And his respiratory rate is 32 per minute at the most of today. It varies from 22 to 32. The respiratory team comes in 4 times a day and give him Atrovent, and salbutamol. Per doctor's, per heart surgeon's order, he will receive 2 units of blood tonight. My husband is lethargic due to sleeplessness. He takes cat naps every 20 minutes. We tried the oscillating positive respiratory pressure device with my husband, but he's so tired he did it maybe 4 times. I hope this will improve his situation. Please let me know your thoughts. I'm so afraid to go backwards. Thank you very much, from Kay. So Kay is actually the gentleman's wife. So, hi Kay, here's my response. It's good to hear that he will get 2 units of red blood cells today. That will most likely help with his lowish blood pressure as well as with his sleepiness. Furthermore, 2 units of blood might also help with his breathing rate. The lower the red blood cells, the less oxygen can bind to the blood. Therefore, the blood transfusion might help with breathing as well. Also, how much digoxin is he taking? Do you know? Here's Kay's response. Hi Patrick. He takes midodrine 10 milligrams for low blood pressure and digoxin 250 micrograms in the morning. Thank you for your speedy reply, from Kay. Here is my response. Hi Kay. I don't think that breathing trials are too early. The picture you sent me showed that the machine is doing some of the breathing for your husband and he's breathing by himself on top of that. The sooner they can get him to breathe on his own again, the better. Therefore, I don't think the breathing trials will be too early. However, I would also want to know what the chest x-rays show and if they have found a reason for your husband why his breathing rate has been going up and then his CO2 or carbon dioxide went through the roof. Have they given you an answer for that? What is important to know is that on the one hand, a breathing trial is good to see where your husband is at. However, on the other hand, he might just need to rest for a few days to get his strength back. They will then pretty quickly see if he can breathe by himself or not. This is also where the day and night rhythm comes in what we discussed over the phone yesterday. You may remember me saying that a good night's sleep is important and it will be even more important going forward. Most patients in intensive care who are weaned off a ventilator will be off the ventilator during the day and on the ventilator during the night when they are asleep. Being off the ventilator during the day is making them tired and then they can rest and sleep during the night whilst being back on the ventilator. Your husband might need a few days like this, and it's really important he can go back to a normal day and night rhythm, as after a couple of months in ICU, his day and night rhythm will be disturbed and upside down. In order to find out why the carbon dioxide or CO2 has been so high, here are the things you need to look for. Number 1, chest x-ray results. Number 2, any painkillers like morphine, fentanyl, endone, etc. your husband may have been receiving in recent days. Those medications are opiates and they reduce spontaneous breathing and it can increase CO2 because they have respiratory depression as the major side effect. Next, has your husband been delirious in recent days? I don't remember you saying so. Next, again, as I mentioned before, mobilization, physical therapy and getting him out of bed will help to stimulate him and hopefully help him breathe and reduce carbon dioxide or CO2. I also hope they have ruled out pulmonary edema. Pulmonary edema occurs when fluids are entering the lungs. This could cause a high CO2 or carbon dioxide as well, especially with AFib or atrial fibrillation and potentially failing kidneys. Because of low blood pressure, a pulmonary edema is something that may have happened. Please ask for this. Depending on the reason they find why your husband had to go back on the ventilator, they may not be able to mobilize him for the next few days, but it should happen again as quickly as possible. You mentioned the blood tests they are doing. In ICU, blood tests are usually done daily. Here is what to look for. HB or hemoglobin, red blood cells. You mentioned he was getting 2 units of red blood cells on Sunday. Find out what his hemoglobin levels are like now. If hemoglobin levels are still low after 2 units of red blood cells, there may be some underlying bleeding. Normal hemoglobin levels are between 13.8 to 17.2 grams per deciliter for men. Next, look for white cell count or WCC. An elevated white cell count is a sign of an infection. Normal white cell count levels are 3.6 to 11. Anything greater than 11 is indicating the potential for an infection. Next, arterial blood gases. Your husband must have an arterial catheter where they can check oxygen and CO2 levels in his blood. Ask for the following results. PO2 or oxygen levels should be higher than 75 mm per mercury. PCO2 or carbon dioxide levels should be 35 to 45 mm per mercury. Lactate levels less than 1 is normal, and 1 and greater than 1 could indicate an infection or sepsis or sometimes cardiac failure as well. Also, ask them if his kidneys are okay. In the blood results, urea and creatinine are the kidney markers, and if they are elevated and could mean your husband's kidneys are failing, which is always a possibility with low blood pressure and after many weeks in ICU. Besides the markers in the blood, also ask them if he has been producing urine, which at the end of the day is the main indicator for the kidneys working or not. I do not want to paint a negative picture, but talking from experience, what might have happened and work out the next steps. Also, as discussed yesterday on the phone, please ensure you are looking after yourself. I have seen many families in intensive care crash and burn when they spend day and night in intensive care. And I have grave concerns for your well-being if you are spending day and night in intensive care with your husband. Having been a shift worker for many years myself in ICU and having done many years of night shifts, I know how unhealthy it is staying awake at night. This is just some food for thought for you. Let me know the next steps and let me know when you want to talk again. It would be good if you could have a look at the blood results and get back to me. So then Kay gets back to me with the blood results and chest x-ray. So she says the chest x-ray is still in the waiting. It will be done today. So then I mentioned earlier that any painkillers like morphine, fentanyl or endone have been receiving, your husband has been receiving in recent days, could increase a high CO2. So Kay says they gave a low dose of Narcan last night. They interpreted the pain versus muscle pain. I stopped this right away. He didn't use the pain medications for at least 3 to 4 weeks. Oh, that's good news. So then, has your husband been delirious in recent days? No delirium, only the night when he collapsed with high CO2. Mobilization, physical therapy, and getting him out of bed will help to stimulate him and hopefully help him breathe and reduce CO2. Kay says that they are sitting him on a cardiac chair today. The goal is 2 hours. Also, they are exercising him daily. He has a good strong plantar dorsiflexion and flexion, does good hand flexion and extension while sitting on the edge of the bed, and he does very good lateral bending and slight neck flexion with a tracheostomy in its way, and moving much better his legs in abduction movement and strong plantar flexion and dorsiflexion, and he's got a good strong hand squeeze. Today, the nurse practitioner also said that he has acute pulmonary edema, but he didn't give me an exact answer why. They are giving him diuretics such as Bumex, and they're controlling his low blood pressure with midodrine. Today, my husband will be sitting on a cardiac chair and on the edge of the bed again, and I will exercise with him tonight. And physical therapy is coming to see him as well. I'm thinking to take the day off tomorrow and be with him there. Another thing, the echo or ultrasound is ordered today to see his heart function, the squeeze or contractility, and the ultrasound on his leg to check for blood clots. They said that one of his legs is skinnier than the other, but I didn't see this, so they have concerns that he might have a blood clot. His hemoglobin level is 8.2 and he was given only 1 unit of blood yesterday. His white cell count is 8.5. That's good because that doesn't mean there's an infection. And there haven't been any recent blood gas results as yet. Now, with hemoglobin of 8.2, you may want to be asking for another unit of blood potentially. No lactate levels have been tested, and bilirubin today is 1.8. Bilirubin direct is 0.04. According to the nurse practitioner, his kidneys are good, producing a lot of urine. Creatinine is 0.56. Many thanks from Kay. Now, that's the consulting session for today. It'll continue next week. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.